a lot. Anyhow, I would like to welcome you and let us see what you have for us, and all the participants, please listen to Dr. Augustine carefully and grab whatever knowledge he is going to have. So welcome, doctor. Thank you very much. Thank you.
So with great joy, I would like to introduce our speaker of the day. And Dr. Augustine is an oral and maxillofacial pathologist who has completed his MDS in Government Dental College Hospital, Aurangabad in 2006. He is currently working as professor in Department of Oral Pathology and Microbiology and Forensic Odontology at Maulana Azad Institute of Dental Sciences. For over 14 years, he is serving the institute. He is also a fellow of Indian Board of Forensic Odontology, for which he serves as a faculty and executive committee member of the association. He is actively involved in casework, teaching, and research in the field of oral pathology and forensic odontology. He has also obtained an MBA in healthcare administration from the Faculty of Management Studies, University of Delhi, and is currently pursuing PhD from Guru Gobind Singh Indraprastha University, New Delhi. He has a keen interest in healthcare, IT, and emerging technologies, and he has also co-authored a book on contemporary dental ethics and professionalism, published by Quintessence Books in 2017. The subject of artificial intelligence, as Principal Sir was mentioning, is really novel and is fascinating, and will create new opportunities for dental research for all the participants. We are really sanctified to have such an eminent personality today with us. Thank you, Dr. Augustine, again. Thank you for being the guest for the day. And over to you now. You can please proceed with your presentation. You can start sharing your PPT.
Thank you so much, sir, for this invitation and for the lovely elaborate introduction. I'll just share my screen. Yeah. There are some waiting in the waiting room. Do I have to do that, or can someone else also admit? Yes, so can you see my screen, sir?
Yeah, the screen is visible. Please go ahead.
Slides changing?
Yeah.
Yeah, okay. So indeed, it's a joy for me to be among you this cold winter morning, and it's lovely that we could connect online, although we would love to be physically together, but the climate and the weather conditions, I think it's the online option is the best for us now. I bring greetings to you from Maulana Azad Institute of Dental Sciences, an institution where I work for the past 15 years. And yes, it's indeed a joy to be among you. Tirthankar Mahavir Dental College is very often in our conversations here. And yes, I've been looking forward to come over and visit the college. My wife has worked there about 15 years ago, and we have fond memories of the place. Coming to artificial intelligence, just have a quick look at this video.
Jarvis. Hello, doctor. शुरुआत में जार्विस इंसान की भाषा बोलने वाला सिर्फ एक प्रोग्राम था. अब ये पूरा आयन नीच. बहुत खूबसूरत.
Jarvis, you there?
That's your service.
Gauge heads up display.
Check.
Portal preferences from home interface.
Will do so.
All right, what do you say?
They have indeed been uploaded, sir. We're online and ready.
We start the virtual walk around.
Importing preferences and calibrating virtual environment.
Check.
So if you watch the Avengers, this is Jarvis. This is the artificial intelligence aid to Iron Man, and you see how he programs and he assists in providing security and advanced applications. And that's where the future is. And if we look at dentistry and what we are going to do in the next 45 minutes to an hour is explore the avenues you have. And you can look through the presentation, you can look at different avenues, and you'll find yourself fitting into some of them. And so you can explore avenues for your careers in future. Now, dentistry 4.0, the pandemic has taught us a lot. And there are a lot of emerging technologies that we've explored during the pandemic, COVID-19. You have AI, of course, you have blockchain, you have a lot of 3D printing happening in surgery and template preparation. We have robotics coming in a big way. You have people who are into robotic surgeries, even in dentistry. You have computer-aided designs, you have augmented and virtual reality is coming up in a big way in dental education. So if we will be looking at a few areas in dental education where this is really good, the Internet of Things, you can do things remotely and do some wonderful stuff with AI in dentistry. So the AI is a broad area. We'll just look at what it is broadly. Now, look into the future. Now, it's not unimaginable. It still is possible even today. Do I need to admit the participant?
I'll be doing it.
Okay.
Please go ahead with the presentation.
So just look into the future. Now, you have mobile applications available now. And so you have the patient who is very aware. He downloads an application, maybe with a small fee, feeds in his data. He feeds in his dental history, his medical history. It asks him about his habit history, either with voice prompt or just through some drop-down menus. And then you have a kiosk, and he's directed to a kiosk. A kiosk is something like an ATM machine. So he goes into that place. There he has intraoral photographs being taken. They can even be taken by cameras in the center or with cameras in his phone, and the voice prompt assists him to take the best photographs, making sure that all areas are captured. And then the kiosk also has data that is fed in, and OPG can be captured at the kiosk. So the patient has given his information, he's given his images to the system. OPG has been taken. So all the information is available to make a treatment plan. Okay, so a preliminary diagnosis is made by the AI tool, and the AI tool assists him to visit a dentist according to the treatment needs, according to the specialization which the AI tool thinks is the most appropriate based on the radiograph, clinical images, and the history. So there you have the dentist waiting for the patient. And when the dentist looks at these records online, he has a lot of information with him. He has information about the patient's oral hygiene. He has information about the habit history of the patient, about the dental caries stature or status, the periodontal status based on the photographs and the radiographs. It can do prosthodontic evaluations using the radiograph and the clinical photographs. It can determine basic orthodontic treatment needs. And yes, you can have oral cancer and pre-cancer screening. So all this is it is available in the research stage as standalone applications, but this kind of a system can have everything integrated so that you have all in one tool. Okay, and then there's an automated appointment scheduling that has been done so that according to the patient's convenience, the appointment is fixed if there are any specific needs, like if the patient is diabetic and needs to be posted early in the morning, all this can be planned by the AI tool for the dentist and for the patient, so that a lot of time and effort is saved and it's done at both their conveniences. Now, once the patient enters the clinic, now the patient has come, the doctor already has his treatment plan based on the AI tool. All he needs to do is physically evaluate and cross-check. Machines can make mistakes. You're the one taking the final call. So you cross-check and make sure everything is in place. You have much more time for patient counseling and interaction, because that's something that only a human touch can do. And so you have a lot of spare time now, because you've automated a lot that is required for your treatment planning and your procedure itself. So what is artificial intelligence? We've talked a lot about what the future will look like. Now, just to make it simple, artificial intelligence is a field of science and engineering, and this is concerned with computational understanding of what is commonly called intelligent behavior, and with the creation of artifacts that express or exhibit such behavior. So it is a computer software or an algorithm that helps create intelligent behavior using a machine, just like the neurons in the human body perform for us. Now, there are different fields of artificial intelligence. Now, there is the physical form and the virtual form. The physical is the robotics, the robotic arms, and we'll talk about that in brief. You have knowledge-based virtual machine learning, which is you feed in the information and then you get the results. And then you have data-driven machine learning, in which the data is utilized and captured, and then the learning is done by the computer itself. So you have supervised and unsupervised learning. So supervised is where you feed in information, like you give it the formula that you want it to use and it will just use it. Or you can do unsupervised learning. You just throw in a lot of images and radiographs and it will pick out the variations. And then you can do a combination as well. Okay, so there are a lot of tools. You have a wide range of tools: artificial neural networks, convolutional neural networks, decision tree, random forest. These are basically different kinds of algorithms that you can develop using based on what you need to achieve. So artificial intelligence is a broad term, okay, and it is very broadly a non-biological ability to accomplish complex tasks. Machine learning is a small subset in which you have neural networks and support vector machines and decision trees. Deep learning is a much more advanced tool which has much more complex algorithms, in which you can have a nested hierarchy of concepts, and you can have convoluted neural networks that can achieve very accurate results, just like the human mind, and rather many human minds put together. Okay, so what are the applications? What we're interested in as dentists is how we apply it. And we look at different fields of dentistry and where it can be applied. This is all based on literature and research that has already been undertaken. So this is not a fantasy world. This is work that has already been done. Okay, so what do you have when you have the patient coming to you? You have the image data. You may have photographs of the patient. You may have radiographic images and spectral images. You may have the patient's electronic medical record, which is the EMR. So you have this text data with you. You have voice data. You may have discussions with the patient that can be recorded and inputs derived from that. You can have the micromotor handpiece sound that can give you an idea of the response of the patient, whether you're doing it well. So you can use it to improve your skills. The murmurs of the patient to know whether there is sensitivity and what kind of feedback the patient is giving you. So this kind of input data can be derived, and over a period of time, you'll have huge volume of data from which you can gather good information. Okay, so you have different types of AI, as I had mentioned. You can use it for diagnosis. So you have cephalometric analysis that can be done by AI. You can identify lesions like cysts, tumors, caries, periodontal disease, TMJ disorders, and then you can do treatment. You can do bridge data acquisition. You can do CAD/CAM and artificially design this this stuff, and then you can evaluate outcomes. You can simulate outcomes even for things like cancer and pre-cancer. You can do a disease prediction. Okay, you can predict outcomes. You can do genomics, and you can prioritize risk factors based on the patient's habits, the heredity and such things. You can put all that information together, and the computer is going to put a lot of information together and give you good results. Okay, so the patient comes to you. You can, as I'd mentioned, you can book an appointment without human involvement. It can evaluate the preliminary levels of disease, determine the most suitable time for the appointment, and it can help fast decision making. Okay, at least the mechanical tasks like booking an appointment, like doing a preliminary screening, maybe taking a consent, a video consent that is required nowadays, all this can be done automated with a voice prompt. Okay. It can communicate. It can communicate with the patient in voice. You know that it happens with a lot of call centers nowadays. The person speaking to you is a machine, so it captures that information. Okay, so you have you can control all that information in the hospital using your AI tool. So sitting in one place, you can using the Internet of Things, you can communicate with a lot of devices, see that everything is functioning, maintain it, maintain the records for maintenance of your dental chair, etc. Okay, you can do treatment planning, choosing the best treatment, and it can pick evidence from the internet and give you evidence as to why this treatment is better than the other, and help you advise the patient more appropriately. Okay, and you get information on the newer techniques as it is. It will give you prompts. Okay, so you can minimize adverse incidents in your clinic. Drug interactions are one of them. So you can feed in this kind of information and give a holistic application to your AI tool. Now you can advise the patient proper medication using AI. Now you give the patient some treatment. Okay, you give him a long-term treatment, maybe for something like Bell's palsy, or maybe even tuberculosis, or some long-term treatment. And the patient, or even just for a simple extraction, you get the patient will get reminders for medication, follow-up reminders at specific intervals to take the drug, post-treatment instructions, making sure the patient is followed up. You have tools now like this gadget you have here, which has all the medication the patient uses. And the patient is given a prompt, and you will know in your app whether the patient has opened that lid at that time of the day, so that you know the compliance of the patient. Okay, so you know, and it will set out reminders that the patient has not opened it. So you have sensors in the dispenser for the medication, and the patient knows that, and you know whether the patient has taken the medication or not. Okay. Now in oral diagnostics, you do have oral cancer screening using photographs. You have the electronic medical record of the patient. You have information of the genetics, the smoking, age, and other data. You have a lot of imaging data, and radiomics is a leading area. You have genomic information, you have proteomic information, you have the biochemistry equipment that can communicate with these tools, since they are also based on software. So you have all this information coming in to help in very accurate and advanced diagnostics. Okay. Radiomics is a big area. You know, radiographs are the most standardized information you have, and OPG is always taken in a standardized way. So lateral ceph is taken in a standardized way. You have standardization in radiomics. So you have a lot of algorithms that have already been developed using the edge detection, or gradients, intensity, textures. So you have a huge volume of data in the radiograph, and you can do data selection and segmentation, and you can choose radiomic and non-radiomic features. You can segment the areas, and even the segmenting of the area can be done automated. So a lot of advancement is available in radiological detection of disease. You have the CNNs used in oral disease. From OPG, you can detect cysts, tumors, dental caries, periodontal disease, TMJ disorders, sinus disorders. There's a whole list of, already there are tools available using radiographs for orthodontics and for almost all aspects of dentistry using OPGs. Okay. Now you can do automated segmentation of a certain area. Suppose you want to see only the third molar, you can segment it so that the computer has a focused area to evaluate. You can data mine and store this information. You can predict outcome and do a prognosis evaluation using multiple radiographs for chronic disease. And you can diagnostic, your accuracy will be much higher when you use these kind of tools. Okay. Now, oral medicine and pathology, my primary area of interest, and you have tools like this in which you have photographic detection of pre-cancer and cancer. You can add cytological and histological molecular information to this, and you get much more accurate information. You can do lymph node detection, either using an X-ray or even histopathological slides, and the software will be able to detect metastatic lymph nodes using radiographs and using the histopathological slides automated. Okay, you can do an identification of cysts and tumors by feeding in the kind of tumor showing a particular pattern, and the computer will find the differences and be able to identify it for you. Okay. So you have, we have whole slide imaging. We have worked on that in association with a university here, and we can detect cancer using whole slide images. You can detect cancer using clinical photographs. You have the Tata Memorial Hospital and the Narayana Hridayalaya in Bangalore, which have done some work on that. You have radiomic data that is available for detection of cancer. So if you put all these together, you can do very, very accurate stuff on identifying cancer, pre-cancer, and differentiating it from normal. Okay. Cytology is being studied in a big way. You can just take cytologic smears in the rural areas where you don't have a pathologist or a dentist, and you can detect a high-risk lesion from a low-grade or a low-risk lesion, pre-malignant lesion or a malignant lesion, and the accuracy is about 80%. So for a country like ours, and when you have a lot of public health activities going on in our country, this kind of tools can be cost effective considering the vast population that you have. With limited manpower, you can reach the interiors of the country and do mass screening, pick out only those patients whom you would like to investigate and treat with a higher risk for malignancy. Okay. Cardiology, restorative dentistry, and endodontics. We have caries detection using radiographs. You have amazing graphics that can, from your MRI and CBCT, give you information of the root canal morphology, okay, and accurate apex location, root fracture. You have cracked teeth that can be very difficult to diagnose at times. So you can identify all these. Okay, so the caries detection, you have very accurate caries detection. Of course, you will have to feed in the information to develop the software. But once you have ready-made software, which is already available, you can detect caries automatically and then just cross-check and evaluate. Okay. Now, this is again based on CNNs. And so you have the X-ray information that you have. Some of you may have thousands and 10,000s of X-rays. These can be put through this kind of software, and you get caries and non-caries. And as you use the software, and if it's a cloud global software that you have, the volumes of data can very quickly give you more and more accurate results over a period of time. Okay, so in endodontics, you can have the location of minor apical foramen, periapical lesions. You have blue root canal system anatomy. You can determine difficulty level. Teachers can assign your root canals based on the difficulty level, just looking at the radiograph with the help of AI, root caries. So a lot of applications for endodontics and conservative dentistry. Periodontics, you have these automated tools for your gingiva, and you have tools for periodontally examining each of the teeth, and this can be done automated with a tool that goes around the mouth. And so you have the periodontal status for the entire mouth. You have the radiographic information that you already have. So you can make accurate information, put all this information together, the clinical, immunological, microbial data. You can pick swabs and put all this information together and determine prognosis for the patient, the best antibiotics, the best treatment modality, and to diagnose aggressive and chronic periodontitis just using the AI tool. Okay. Now you have temporomandibular joint disorders, and we have this, this is already published data. So you have data capture of the patient, and then you have the blood and serum information, CBCT information, the information from the clinical examination. And so all this data together is processed. You have data analytics going in and machine learning that can help identify the TMJ disorder and also help in giving you decision-making support. Okay, so this kind of tool is available on the cloud. You pay per patient, or you can have different kind of modalities, and it can help make accurate TMJ diagnosis. The patient also is more confident because it is something that is reviewed over a period of time, and you also have the assistance of technology. Ultimately, you're the one who's going to take the call. Okay, you have some good orthodontic tools. Okay, so you have this kind of tools in which you can get the cephalometric information. You have different measurements that can be done using this tool. Okay, you can use your different indices, and it will just give you the different indices on your cephalometric. So it does the treatment planning for you. It suggests the best option available, and it will also show you the pre and post, what kind of treatment modality will give you what kind of results. Okay, so you can predict the treatment. It gives the patient and yourself much more confidence, and you are in a much better position to identify what treatment outcomes you're going to have based on the analysis that it does for you. Okay, forensic odontology. It's an amazing tool, and it's in the research stages right now. It can help. Yes, you have, even the Interpol has this kind of tools available. You can use the antemortem and postmortem information from photographs and x-rays, and it will put it together. And because say it's a mass disaster, if it's a tsunami, so you have maybe 10,000 you have antemortem records of 10,000, and you need to choose 100 or 200. This can help narrow down the search. It can help do it very fast. When we do it manually, and we do it manually here, it takes several days and a lot of hard work, sleepless nights, but this can narrow down the search within a matter of a few minutes, and it gives you more time to really focus on those comparisons that you need to do manually. Okay, you have amazing software that can be used for superimposition of a skull with a photograph, and it can do it on a large volume of data. So if you have a skull or multiple skulls, it can superimpose them with photographs, and you can identify or at least narrow down the search to a few individuals who are likely to be the individual. Okay, and this kind of tools can make it very fast. You can get into research in any one of these areas, and you can help humanity with these kind of tools. Okay, now the application for the treatment of diseases. Now we've just talked about diagnosis, treatment planning. Now, how can you use it for treatment of diseases? For treatment of diseases in maxillofacial surgery, you have 3D printing that is being used. You can segment the mandibular canal so that when you're doing a surgery, you can prevent damage to the mandibular canal. You can segment the part of the parotid gland. You can improve speech intelligibility of the patients. So the speech training can be done with AI assist. Okay, and so it will record the speech. It will see where things are going wrong. So you can do speech therapy using maxillofacial these kind of tools, especially in patients like you have cleft lip and palate where you need prolonged speech therapy. So it will help the patient. It will prompt the patient to tell him or her how he can improve the intelligibility of speech. So there are a lot of tools that are already available, and these you can even assist in putting these together to make them even better. Okay, prosthodontics, another area where computerization has come in a big way. You have automatic detection of teeth and segmentation of teeth. So just a photograph and it will be able to identify which tooth it is. Okay, and so which tooth needs to be replaced, the tooth morphology, making mirror images of the adjacent teeth so that the color matching, the morphology matching can be absolutely accurate. You can have designing of the prosthesis. You can segment the enamel from the dentine, from the pulp, so that when you're doing cavity preparations or tooth preparations, you are safe, in a safe zone. You can do removal of resin restorations accurately. You can match shades very accurately. It can help you a lot in designing of RPDs, functional restorations. It can measure masticatory efficiency. You can take your face bow records and transfer it to the software. So it's working on occlusion. It's working on the morphology of the tooth. It's working on the biomechanical preparation. So you just scan the oral cavity and you get 3D scans of the mouth. You have the face bow records, and these can be transferred accurately, and you can get very accurate prosthesis with using CAD/CAM technology, and so you get very accurate results. Okay, we talked about orthodontics. You can take therapeutic decisions, as I showed you in 3D. You can evaluate the outcome. There are studies on the assessment of facial attractiveness and the apparent age pre and post treatment. And so the software will give you the results of whether the face looks better, whether the apparent age pre and post treatment, and these can help even the patient. The patient will now know how his or her treatment is going to eventually turn out. Okay, robotics are coming up in a big way. Okay, you have robotic surgical, you have robotic surgeries happening. You know of it happening in cancer and pre-cancer, especially cancer treatment. You have it happening even in restorative dentistry. You have planning and robotics coming up in a big way. I'll show you a few examples as we go on. Extraction, you have robotic extractions. So this is a tool for robotic extraction. It will accurately go pinpoint and you just identify the tooth and it can atraumatically extract the tooth. So then when you want to do implants, you have minimal destruction of the area and you can remove a tooth using robotics very accurately without doing much tissue destruction. Okay. Restorative activity using robotics. I'll just show you a short video of how restoration can be done. This is a company that has come out with this tool, and you can just
Removal faster and more effective. Our engineers have developed a prototype for a series of dental micro drills. Let's see how they work. First, the patient bites down on the body of the device, which looks kind of like a polyurethane boxer's mouth guard. The body of the device protects the palate, tongue, and gums, leaving only the affected part of the tooth accessible. Inside of the device are servo motors that move the head, which houses miniature cameras, LEDs, nozzles for water, and compressed air, and a drill that rotates with a speed of up to 100,000 rotations per minute. The device is firmly fixed within the patient's mouth and does not alter its position during the entire operation. The technician marks the affected areas of the tooth, setting coordinates for the points along which the software will build the drill's future route. The more key points the technician marks, the more precise the route will be. The device is controlled using a controller that transmits the movements of the technician's hand via servo motors. The technician's hands are placed comfortably on a desk, and the movements and force transmitted to the device are amplified by a magnitude set by the technician. The drill's movements are thus very precise and carefully calibrated. The technician monitors the position of the device in a space with a precision of up to a few dozen microns. Once the route has been set, the technician runs the program. The drill begins to rotate, descending into the tissue of the tooth at a preset depth and moving along a predetermined pathway. The technician observes the device as it executes the program and makes sure everything goes according to plan. By the way, thanks to the fact that interference with the tooth's living tissue is minimal, the patient feels virtually nothing, and no anesthesia is required during the operation. The operation only takes a few minutes, after which the inside of the mouth is washed and the tooth.
Okay, so that's where technology is now. It's protecting the tongue and the cheek, and you just have to, even a technician can identify those points, and then it does it accurately with minimum tissue damage, and you can control it, and it can give you very accurate results, and you can restore the tooth with minimal damage to the normal tooth structures. Okay. So now you also have implant placement by AI assisted robots. And so you can very accurately place implants, and the robot helps assist in the treatment planning, and it also places the implant for you. So with minimal vibration and with minimal shake of the arm, it can place the implant very accurately in the patient's mouth and give you much more accurate results. Okay. Now, CAD/CAM and 3D printing, we know this is happening in different parts of the world. So you have computer-aided design and manufacturing, 3D printing that can give a prosthesis with occlusal contacts in a favorable manner and chair side. So you scan the patient's mouth and you treat your other areas, and by the time within 2 hours or 3 hours, you may have the prosthesis ready, and the patient goes out with a prosthesis that is very accurate, and you don't need to make any adjustments in that prosthesis. Okay, so you have this kind of tools, and I'll just show you another tool for prosthodontics. It's a small clip I've taken from there since we have little time.
Effectively, for dentists, using technology from Glide was like having a super dental tech in his office. We know that when people design crowns, the results can vary, but here we'll get consistent high quality results every time. Dentists should expect much more streamlined workflow, high quality results.
So you have high quality results and very accurate prosthesis, and it's consistent and it matches with the surrounding dentition. So you get good prosthesis that fit well and can be fitted in a very fast and accurate way. Okay. Now, virtual reality again is being used in a big way in dentistry, especially for training. And we'll look at how virtual reality is being used?
This research is certainly the first surgical simulation of this kind in Thailand, and most certainly the first in the area of dental surgery. And certainly worldwide, we are the leading group in this area of applying AI techniques in virtual environments for surgery.
So you have virtual training environment for dental surgery. It makes it much more accurate for you to learn, and it gives you a simulation of the vibration of patient interaction. The patient will also make a sound, and so the mannequin can help you in teaching you how the patient is going to react. You can have assistants for teaching you local anesthesia and a lot of different surgical procedures. You do have these kind of intelligent mannequins available, and virtual reality can give you the feel of advanced procedures without having to harm any patient in the learning process.
This research is certainly.
You can use augmented reality. Now we do use augmented reality even today in teaching. Now the patient can have a view of what the patient is going to look like, the spatial arrangement of different objects in a clinic. The information comes down the lenses. So the patient also, you can click pictures and it will give him an augmented reality in his own image of what post-treatment is going to look like. Okay, so the patient, you can see the patient at the back, he has a device and he's seeing a video of himself with the treatment. So augmented reality will give you live simulation of smile design. It can give you live simulation of treatment procedures, pre and post. So the patient looks at his own face in real time through augmented reality as to how he's going to look after treatment. Okay, so you can use it for patient education. Augmented reality tools, the patient can hold it in his own hand, see how it's going to look, and pre and post treatment for different treatment modalities, also different shapes of teeth, different tools. Okay, I remember when I was in college, I had a friend from Mumbai who had a barber who used to use different hairstyles using augmented reality and give them images in those days in the 90s, and we would be amazed. But it's very much available now in maybe 30 years from now, from then, and it's available to dentistry as well. You can do a lot of patient education. The patient will be convinced much more faster, and you also know how the patient is going to look post-treatment. So the treatment becomes more predictable. Dental anatomy, we have these tools now, and you can rotate the tooth in 3 dimensions. It will help you study dental anatomy much better. It will help you in your carving. It helps you in more accurately understanding both dental anatomy, human anatomy, and oral and maxillofacial anatomy using these augmented reality tools. Now, we've gone through a lot, and yes, the idea is to give you an overview of AI in dentistry. Now, if you're getting into research in AI in dentistry, you must be aware of the standards. You know, there are standards in research, and so standards are available for dentistry as well. Okay, so this article in the Journal of Dentistry by Fox-Swindecke gives you the checklist for anyone doing research in AI in dentistry. Okay, you have reporting guidelines for clinical trial reports. That's called the Consort AI. So if you're doing clinical trial, reporting clinical trials in AI, these are the standards you can look into. These are published in Nature Medicine. If you're doing clinical trials and you're designing protocols for intervention, then you have the Spirit AI, which is the standards for AI in clinical trial protocols. Okay, if you're doing AI-based diagnostic text accuracy studies, then you have the STARD AI protocol that is published. So if you know the standards and you design your research accordingly, then you're less likely to have substandard work. Okay, so if you want to do standard work that is acceptable anywhere in the world, then you follow these guidelines when you start off, when you make your research proposals, you use these so that you have something that is standard and can be used across the globe. Okay, you have a checklist for artificial intelligence in medical imaging, claim. Okay, so if you're doing something on radiology, you want to develop a tool in radiology, look into this. These guidelines, these will give you all that you need for you to be able to accurately do your research. Okay, so that you don't make something that is not applicable anywhere else in the world, because anything that you do will require a lot of effort, lot of money, and it will require funding. So you need to be able to do it in the best way possible so that your effort and your inputs don't just become substandard software. Okay, so where are we going? Are we going to lose the human touch, as Principal Sir rightly said? And the question that we often have is, are we going to lose the human touch? Is it going to be all AI and dentistry going to be in the hand of machines? Now, the top tech voice in China, Kai-Fu Lee, said AI will be bigger than all other tech revolutions, and robots are likely to replace 50% of all jobs in the next decade. Okay, so this is a top Chinese individual giving us that. And the co-founder of Sun Microsystems, Vinod Khosla, he says machines will replace 80% of doctors. Okay, 80% is a big amount or a big number. If we are 100 students, 80% going out of job. That's what he thinks. Okay, the godfather of neural networks, Geoffrey Hinton, says that if you're a radiologist, then very soon you're going to be out of job, because you wouldn't need radiologists anymore, because you're like Wile E. Coyote. I don't know whether you remember or any of you have seen The Roadrunner. Okay, it's a cartoon we kids often watch, and you have Wile E. Coyote. He runs across a cliff and he keeps running till he looks down. He keeps running even though he's crossed the cliff. And when he looks down, he starts to fall. Okay, and so similarly, he feels that radiologists are just running across the cliff, and before you know it, they'll be replaced by AI. Okay, that's the inventor of AI and his imagination of the future. What do you think? I don't think so. I think healthcare will need many more humans in future. Okay, yes, even though technology is coming, you're not going to be replaced. Okay, empathy cannot be replaced. It's very difficult for you to mimic compassion. Okay, there is a process in which you build trust. Okay, you listen to the other person, you understand, you feel what he feels, and that feeling of understanding cannot be replaced by a computer. Okay, only a human can understand what a human is going through. Only a human can communicate with a computer, with a person, the way a real human being wants to be heard. Okay, so empathy is never going to be replaced. Okay, so continue to be empathetic with your patients. Okay, physicians have a non-linear method of working. Okay, every patient is different. Every diagnosis is different. Okay, and it requires your creativity, your problem-solving skills, and algorithms are not going to be replacing that. Okay, every patient is different in his lifestyle and his understanding. Okay, and no case, is the same. You need human attention. And so you cannot replace a human with AI. Okay, you're only going to use more technology. You are going to be as indispensable as you are today. Okay, so this will improve access to healthcare. It will improve your interaction with the patient, and it's going to make your job much more accurate and much more easier and improve it. Okay. So complex digital technologies, as you have more digital technologies, you need more competent professionals. Okay, so those who use AI or use robots are going to be those who are more competent in using these technologies. So you need more complex analysis and decision making, and that is going to be done only by a human. Okay, you're studying 5 years in a dental college and maybe many more years after that. And so you are the one who knows the environment, who knows what the patient needs, and you're developing a lot of skills apart from just what you're learning in the college. You're looking at things, you're observing things, and this kind of learning does not come easy to a computer. Okay, the computer is going to only learn mechanically. Okay, and you're going to be able to handle those complex tasks. Okay, what are the ethical issues? Who's going to be ultimately responsible when a AI assisted tool is going to harm a patient? Okay, it's you. It's the doctor who's going to be treating. So you are the one who's going to be in control eventually. Okay, data security, a lot is being said about data security. What about data security? Is the patient's information safe? So you need to take these things in control. You need to know about data security to be able to handle this kind of tools. Okay, monotonous tasks can be handed over to the computer. You can do appointment scheduling. You can do account settlement, management of these claims from the insurance company. Maybe the patient instructions. You can audit your procedures to see whether you can do something better and faster. So this kind of tools can be done using AI tools. Okay, there will always be tasks that robots cannot complete. There will always be tasks where humans will be faster and more reliable. A patient is going into syncope, you call out for help and people come to help. You have something that is falling apart and you can get people together to handle those things faster. Many a times, a lot of things can be done faster by humans. Okay, so it's not human versus tech versus touch. It is hand in hand. Okay, it's not a enemy image building. It's not that AI will replace me. Okay, technology, it's not technology versus humans. It is going to help you. Okay, so it's going to help you, and both together will be potent when we cooperate. Okay, when we learn technology, use it to our benefit and not think of it as a threat. Many of us older ones think it's going to be a threat, but the younger generation, you people, you are familiar with technology and you can use it more potently in your dental practice. Okay, so the bottom line is AI will not replace dentists, but of course, dentists who use AI and present these social skills will replace those who don't. Okay, so it's high time we look at technology positively. We look at how it will help us rather than think of how it's going to replace us. It's not going to replace us. But yes, if we are not familiar with technology, technology is going to replace us. Okay, so that's an overview of AI in dentistry. And I hope you could find something of your interest over there. And you'll be able to build on a career using technology to your betterment, and you find great avenues and challenging areas so that you can make your career a great success. Okay, to end, I would like to thank my department of oral pathology and forensic dentistry at Maulana Azad Institute of Dental Sciences. Any kind of talk does not happen without the support and the inputs from everyone in the department. And so I'd like to thank my department also for contributing to help deliver this presentation. Thank you.
Well, thank you, Dr. Agustin. It was a wonderful talk. I would ask our audience to unmute if they have any questions.
Sir, good morning.
Thank you so
I'm
much,
Dr.
sir.
Anish.
Good morning.
Yes, yes.
Sir, can I ask a question?
Please do.
Sir, is there any tele-dentistry software or something you can advise us to deal with the patients of pre-malignancy at home, because sometimes in COVID we have seen these cases, and this time in North India so much cold is there, so some patients are not coming to the clinics regularly, and they are worried about their health. So can we do it legally, or is there any pre-existing softwares are there for teledentistry? Is it
Yes.
legal, or we have to develop on the by its own, or we can consult it on WhatsApp or something? What do you advise, sir? Is
Yes.
there any AI
See, there are
involved?
tools available. The government also, through the National Informatics Corporation, the NIC, has developed something called eSanjeevani. Okay, and that is a tool in which you can record the patient's, the patient can feed in his history, and then it connects with the doctor, fix an appointment, and you can do it online. Okay, and this is legal. It has a consent format also, and it is operated by the government. Okay, but you also have teledentistry AI tools, not AI tools as of now. You have teledentistry tools that are available. You have tools from hospitals like the Apollo Hospital and others do have tools. So you can explore on these kind of tools for teledentistry. The easiest, of course, in the situation is to use WhatsApp. But then, yes, you must have some documentation of all that you do. Document it. You should have a consent procedure in place so that even this teleconsultation is not done without the checks and measures. And so you have some facility to record so that you don't get into a legal problem later.
Okay, sir. Thank you. Thanks a lot.
Hello, Dr. Augustine.
Yes, ma'am.
Can I ask a question, please?
Yes, sure.
This is Dr. Nilima from Oral Maxillofacial Department, Dr. Meghanand's college itself.
Yes,
Hello, sir. Sir, I just wanted to know how reliable and accurate the artificial intelligence is in our field of like we depend so much on oral pathology while doing any resection or waiting for a actual final diagnosis of any lesion.
Yes. There is software, there are algorithms available for cancer and pre-cancer, both in cytology and in histopath. But still they are in the research stage. I don't think anything has been commercialized as such. There are patents which people have filed even in India. So there are softwares available, but I'm not very sure they are still commercially available for oral cancer detection.
So do we have enough documentation evidence for like artificial intelligence?
Yes.
Using
yes, there are published papers for cancer detection, pre-cancer. There's one from Narayan Hridyalaya in Bangalore on cytology. There are some papers on oral cancer detection, even lymph node metastasis detection, not in oral, but in breast and other areas. So there is published work in AI in different areas of pathology.
Okay.
Yeah.
Thank you so much, sir. Thank you.
You're welcome.
Hello.
Yes, sir.
Good morning, Dr. Augustine. It's a wonderful lecture. I have a question, 2-3 questions from my side.
Yes.
Hello.
Yes, sir. I can hear you.
I'm audible?
Yes.
Yeah.
You're audible.
Yeah. First question is that your presentation is very good and it's really very impressive, and a lot of information you have been gained, and you have shown certain videos, pictures also. It's really appreciable.
Thank you.
And second thing is, I'm working as a professor and head in Department of Oral Medicine in same college.
Yes.
And working. Yeah. And second thing, you talk about the lymph node applications. So could you tell me something about the lymph node applications? Because this is first time I'm hearing about the new application of AI. Good evening.
Lymph node, there is software, there is a paper on using radiology, using CT scans and being able to detect lymph node metastasis in head and neck radiology. And also some work on breast cancer metastasis in lymph nodes.
Okay.
There is some work happening in head and neck also, but not much.
Okay. Okay. Thank you. Thank you. Sir, another thing, because this radiology plays a very important role in the AI and the way you are giving interpretations, and it is a data store algorithm where the interpretation will depend upon the thing, upon the person to person. Suppose I have a center and I have the couple of cases and it has become thing, and different multi-centric centers were there in India, in other areas. So how the reliability of the diagnosis will depend? Accuracy of this particular diagnosis, it helps.
Sir, eventually it will help you narrow down on your diseases. Eventually, I think the radiologist will have to take a call.
Okay.
Because ethically, ultimately, he is responsible for that diagnosis. So it can help assist.
Okay.
But giving it to AI will have, who's going to take the responsibility? The company may not take.
Okay, definitely. I
think eventually it will help you make a better decision. But the final call will be of the
radiologist. Okay. And do you think the histopathology will play any role in accompanying the radiologist diagnosis as we do?
Yes, sir. Actually, there is standalone histopathology software being developed for cancer and for other diseases, even for lichen planus and these kinds of diseases. But now it's time that these kind of integrate with the radiographic information, put things together to get better results.
So any last question, sorry. Any applications were there in forensic odontology? Forensic fields? Anything?
Yes, there is a radiological comparison tool available.
Okay.
Yeah. And bite marks also some people have developed 3D comparison.
Okay.
And age estimation and age estimation using it's much easier in age estimation using radiography because you just need volume of data. There are people who have worked on that. And identification also, there is some work, more of repository collection as of now, because you need huge volumes for that.
Thank you so much. Thank you very much. Thank you. It's a wonderful presentation from you.
Thank you so much.
Anybody else has any other question? Please unmute yourself and you can ask the question. Okay, I guess no more questions, Dr. Augustine. Really, it was a wonderful presentation. I would just like to give the mic to Dr. Geetanshu. She will be proceeding with the vote of thanks. Dr. Geetanshu.
First of all, thank you, sir. It was a very, very enlightening session. And I think AI is, a very, very innovative technique. So I really extend a very heartfelt thanks to you for taking out time in spite of your busy schedule, to enlighten us about such an innovative topic. Thank you so much, sir. Next, I would like to thank the management of the Tirthankar Mahavir University for providing this conducive environment for conducting such CD programs. I also extend a heartfelt gratitude to our principal, Dr. Manish Goyal, sir, for his constant support and guidance for such educational endeavors. I also thank Dr. Meghanand Nayak, without whom the CD program would definitely have not been possible. I extend thank you to all the staff members of Department of Oral Pathology and our dental college for helping us make this program a success. And last but not the least, I'd like to thank all our postgraduate and graduate students for their patient hearing. Thank you so much, sir. It was a wonderful session.
Thank you so much for having me.
Before you did, like, I would like to present a certificate, online certificate, sending you the copy of it. Just a minute. Is the certificate visible?
Yes, sir. Thank you. Thank you.
Thank you so much for presenting this webinar. It was a really wonderful one. I guess our students took some important message from this, that like the artificial intelligence is here to assist us rather to replace us. It was definitely a fascinating topic, and thank you so much for this.
Thank you. Thank you so much.
Okay, then. Thank you all. I'll be ending the meeting now. Thank you.
Thank you.